Good morning. Welcome to the audio lecture for Chapter 1, Healthcare Delivery Systems. I want to make a couple of announcements concerning notes and audio lectures. Every week, for at least 2 days out of the week, I will be uploading audio lectures for the PowerPoint slides. Now, this does not take away the PowerPoint slides that are available to students in DocSharing. Actually, I have all of those slides already loaded for chapters 1 through 10. And again, those are the PowerPoints in DocSharing. For chapter 2, there may be some additional notes that will be given on some of the professions that are not already listed in the PowerPoint slides, but I do have additional information for that. Although I do audio lectures, basically in my audio lectures, my job is to just sort of go through the slides and give explanation on some of the slides, allow my audio lectures to serve as a roadmap per se. Same thing with the slides. All of them are to serve as like a roadmap. Does this take away your responsibility of reading the chapters? No. You're still obligated and required to read your chapters. One of the things I do want to point out in this particular class and with your book, there's a lot of great information inside of the book, and the book is very self-explanatory. The book is laid out in layman terms, meaning that there should be any difficulty in a lot of the things that you read. If you find some difficulty with some of the subjects or some of the concepts, please make sure that you reach out to me so that I can better explain it to you. Let me give you a little snippet or a little nugget for doing your activities and especially your homework. If you will take the time to actually open your book and read it to get an understanding. If you actually take the time to do that, you will do well on your homework assignments. It is a proven factor. When it comes to your activities, if you will take the time to actually research your answers, it will be easy for you to do your activities. Basically, everything that I give you in the class mimics the material that's in your book, mimics the material on the slides. Now, I do need to caution you about the slides. The slides are not always going to be in what we call full detail. They're going to be just a brushing or an overview of the chapter, because again, the expectation is that you have read the chapter and you've read the chapter to get an understanding of the concepts and the material contained in the chapter. So with that being said, we're going to go ahead and start with chapter 1. This particular audio lecture is only on chapter 1. There will be a separate one loaded on a separate day for chapters 2 and 3. So when we look at chapter 1, the subject says healthcare delivery systems. So let's kind of talk a little bit about what was it like back in medieval or prehistoric times. Back in the day, a lot of diseases and conditions were cured through what we call supernatural. Okay. A lot of individuals at that time did not have access to a physician per se, or nurses, or even a lot of the advanced technology that we have now. A lot of those things were not available to us as they are now. So with that being said, when you look at prehistoric medicine and ancient medicine, slide number 1 tells you that this was characterized by the belief that illness was caused by the supernatural. Actually, a lot of people actually thought that illness to the body was like an evil spirit. It was like if you were sick with something or plagued with something, you had an evil spirit. That's what they believed back in the prehistoric and ancient times. During the medieval period, what we call that period the Middle Ages, the most significant thing that took place back then was what they called the bubonic plague. So, back in the day, a lot of different illnesses and diseases plagued communities, and populations. This was before we had all of these fancy vaccinations, and like I said, the hospitals and other medical and nursing professionals. Before all of that came about, plagues was prevalent back then. You had more people that died from these plagues back then, because you got to understand, we didn't have all of the vaccinations and things that we have now. Okay, in your book, in table 1-1 in your book, on page, let me get to that page for you, because I want to point this out, because I do want you to make sure you read over this. So in your book, on page 2, there's a table 1-1, that talks about prehistoric medicine and ancient medicine. And basically it goes through all of the different periods. Like during the prehistoric period, there were different types of medical practices that took place. One being the belief that angry gods or evil spirits caused diseases, and tribal priests to have different spirits over their bodies. Back then in prehistoric medical time, they believed that plants were a way to relieve pain. Okay. In ancient medicine, some of the medical practices were, they believed that in ancient medicine, they also believed that illnesses was caused by supernatural effects. Okay. During that time was a lot of Greek philosophers came along during that time. Like one meaning that a lot of Greek philosophers believed that the 4 elements of earth were like air, water, fire, cold and dry, moist, hot air. They believed that those things were things that were causing the atmosphere that caused individuals to have a lot of diseases and illness to plague their bodies. Then we're going down to the medieval medicine. That's in table 1-2. So again, in the medieval medicine, it was characterized by lack of education amongst individuals. And of course, the most significant thing that happened during this time was the bubonic plague. The medieval medicine was often managed by monks and nuns. The care of patients were based on charity rather than on scientific principles. Okay, then we get into table 1-3. It talks about the Renaissance medicine. Now, this is between the year of 1300 to 1600 AD. This was mostly associated with the country of Europe. And this type of medicine was characterized by a renewed interest in arts, science, and philosophy. During the Renaissance time, this is where we see the beginning of modern medicine, where now illness is based on education versus spiritual beliefs. Okay, so we get into that time. During the Renaissance medicine, syphilis was epidemic. This was around the 16th century, the disease syphilis. Okay, so then we come on up to modern medicine in table 1-4. Now, in modern medicine, we are a little bit more detailed, because now, as we stated, from Renaissance to modern, we start focusing more on education. Education meaning that there had to be standards set. So this is where we start seeing in modern medicines, where you start seeing the implementation of sanitation, ventilation, hygiene, and nutrition. So with sanitation, we start worrying about, is an area clean or well sanitized? And ventilation, are areas well vented? Because one thing that you may not know, but me having the background in lab, bacteria and germs live in warm places. They can't stay in a cold environment. Cold environment tends to kill the bacteria, whereas warm environments tend to attract bacteria. So being in a well-vented area is key when it comes to illnesses and diseases. It's just like when you have a sore or a cut or something of that nature. A lot of times you have to be careful when you bandage those areas, because hot, moist air a lot of times will cause the bacteria to spread and grow even more. Okay, let's look at hygiene. You know, and it's just obvious with hygiene. You don't clean your body, then yeah, you tend to harbor germs. Your body is dirty. It's full of bacteria. So having personal clean hygiene is very important. Nutrition is important. It's not good to consume a lot of red meat on a daily basis. It's not good to consume raw meat, because you got to understand those kind of things. First of all, red meat stays in your system a long time. It really does. And a lot of times it doesn't always process out like it should. It too can build up bacteria, cause you have different conditions and stuff in your body. When it comes to raw meat, you got to understand raw meat can carry bacteria. So when you consume that bacteria is now in your body. So that can cause you to have a disease or an illness. One other thing about modern medicine is that we get into choosing healthcare as a profession. Training of physicians and nurses were improved around the modern medicine time. A lot of great things happened around this time. A lot of great things. Such as the guys Louis Pasteur and Robert Koch. They were the individuals that were responsible for coming up with the theory of disease as it pertains to germs. Basically the microbiologists, because they started studying different bacteria and germs to better assist physicians in diagnosing patients. So make sure you look at those tables in the book so that you can see a lot of the things that were happening around these different time periods. So when we look at delivery systems, we think about the word continuum of care. Continuum of care, as it is listed on the slide, basically that is the complete range of programs and services. So what does that mean? That entails three main different categories. You have your primary care, secondary care, and tertiary care. And we're going to talk about each one of those, okay? And I'm going to help you with the significance of each one of them so that you can see how they're tied. They're stagnated in order like that because that is how care is given on a daily basis for every patient. You go through a primary care stage, a secondary care stage, and a tertiary care. When we talk about continuum of care, that is pretty much your ongoing needs associated with your health care, whether it's medical care, whether it's psychological care, whether it's social care, or any type of service. So let's talk first about primary care. Primary care, the way I want you to remember this, and I have it listed in the notes, I want you to remember it as the point of first contact. That's the first point of contact. Actually, that's your contact with the physician. This is where you get the first set or the first onset of preventative and acute care. Usually doctors can go ahead and fix you up right then and there. Primary care is like when you first go to the doctor. You go to the doctor for a runny nose. He examines you. He gives you some meds. The next day, you're feeling great. Sometimes that same day, you're feeling good. That's primary care. That's acute care. It's really quick, not long and drawn out, and you get to the point. Primary care is usually given by a general practitioner or some other healthcare professional. That may include nurse, that may include an x-ray technician. The whole point of having primary care is this is the stage where you receive managed care from your physician. A lot of times, if we can do what we really need to do at the primary care stage, you can usually prevent having to go through secondary care and, if needed, having to go through tertiary care. Primary care is used for physicians to have private consults with patients. A lot of other things. This is where you have a lot of screenings done. This is where you get a lot of educational material, things that help you. Like, say for instance, if you're borderline for diabetes, this is the primary care stages where you get the ramification, or shall I say, the information that helps you to prevent diabetes from coming up on you. You might be borderline, but then you have diet plans, you have exercise plans, and you get all of this information at the primary care stage, because at that stage, if you can comply with those things, then you can push off diabetes coming up on your body. Secondary care is that care that's given by medical specialists or hospital staff. So let me give you an example. Say, for an example, you do go to the doctor and you have what we call possible pneumonia. Secondary care is that stage where whatever test or procedure needs to be completed or needs to be conducted in order for the physician to better assist you with your healthcare needs, or for him to better find out what's going on with you, that's usually going to happen during the secondary care, because that's going to mean some other type of specialist or support staff or hospital staff is going to give you that test or service to help the physician diagnose to see what's going on with you. Okay, now we have tertiary care. Tertiary care is that service usually given by a specialized hospital. These are hospitals that's equipped with special equipment or special treatment facilities to take care of your needs. For an example, patients that have strokes, they go through a special rehabilitation facility to help them with language and speech pathology, to help them learn how to walk again. Think about your physical therapy, occupational therapy. All of those are designed to restore one back to health. That's the tertiary care phase. Now, the quaternary care, you don't hear a lot about that, but that's really an extension of tertiary care. So quaternary kind of goes into what we call more advanced levels of medicine. Let's think about the cancer center as being an advanced level of medicine. So you've gone through primary care, secondary, and tertiary, but a lot of times you may have to go through a more advanced stage. And I know, like for cancer patients, they do. And so when you look at those type of specialized centers, those centers, they cost more, of course, but they have more advanced technology. So what do we mean when we say that healthcare facility has particulars in ownership? One being not-for-profit. Your not-for-profit are usually your government and your voluntary facilities. These are all supported by local, region, federal taxes, religions, or other voluntary groups. Okay? Your for-profits are known as your proprietary. Usually they don't get the donations from the local charities and things of that nature. They actually depend on what they have coming in as their source or their means of surviving. Okay, so they don't get the donations, the charitable things and things of that nature. Those facilities are much harder to run, because everything that they do is very, very important, because, like I said, they don't get that outside assistance. Teaching hospitals are usually those schools that are associated with physicians that are in residency. UAB here in Birmingham is one of the top medical schools for teaching. They're known as a teaching hospital. And they do have a lot of residents that come from different countries and different other parts of the states and surrounding areas to come to school to get that teaching. So how are healthcare facilities organized? In Chapter 1, this is just a basic overview of healthcare systems. Healthcare systems are organized, starting with the governing board. Your governing board is always going to be your board of trustees, your board of directors. These are the individuals that make the major decisions about the facility. They're the ones that decide whether or not a facility is going to shut down and move elsewhere, or they're the ones to decide whether or not they're going to add on to the facility, or if they're going to bring on a new service or something of that nature. Those are the individuals that decide that. They have the authority and responsibility for maintaining the operation of the hospital. Under the governing board, you have what you call an administrative staff. Now, this is your medical staff, and this is also your governing body. Their role is to make sure that they support and push out the mission and goals of the organization. That's their responsibility for doing that. Okay, and then you have what you call your medical staff. So your medical staff are your individuals such as your physicians and other licensed providers. So when I say licensed providers, we're talking about your nursing staff, your x-ray staff, your front office staff, your billing staff. All of those are individuals that all play a part in the medical field. They play some role in a patient's health care. Then from there, you have your hospital departments, services, and committees. So when we talk about different departments, we're talking about lab. We're talking about nursing departments. We're talking about let's see, what other departments? Infection control, quality management. You got your admitting department. You have chaplain services. You have laboratory. You have biomedical. You have emergency department, employee health services, health information management services, community relations, human resources, information systems, legal services, medical education, dietary, occupational therapy, patient advocacy, patient education, and the list goes on and on and on. These are all of the different types of hospital department services and committees. And then you have what you call successful meetings. These are made up of the different committees, and those different committees have the responsibility to make certain changes as needed within a hospital, such as you have medical staff committees and hospital committees. So your medical staff committees will be things like a credential committee, and their job is to review and verify medical staff application data. You have your ethics committee. Their job is to discuss and monitor ethical issues or problems that occur. You have your executive committees, and you have your joint conference committees. Then on your different hospital committees, those can be committees such as disaster control, drug utilization, finance, infection control, quality management, risk management, tissue review, transfusion, utilization management. All of these are different types of committees that help provide decision making for the medical facilities. Okay, now let's talk a little bit about the health information department and some of the roles and careers associated with that department. Now, there is a department known as the Cancer Registry, and what you're going to find in the next few slides is that I'll give you a lot of different career professionals, and basically when I give them to you, it'll talk about some of their duties, education requirements, and places where they're able to obtain jobs. So Cancer Registry are usually certified tumor registrars that work in the department, and their job is to maintain records as it pertains to cancer patients. Okay, so they do a lot of coding that involves numerical and alphanumeric codes, and this is to help physicians with diagnosing different type of procedures and services. They can assemble and unassemble discharge patient records, current patient records. They keep track of incomplete records. They have a computer tracking system that helps them keeping up with that. You have medical transcriptionists that work in the health information department. Basically, their job is to transcribe dictated reports. Record circulation, that's where retrieval of patient records take place. That also takes place in the health information department. This is for patients that have scheduled, unscheduled visits, inpatients, readmitted patients, also education and research. Releasing of information process. Patient records are never to be released without proper documentation. This is something that you learn on the job real quick. So if a patient comes to your facility and request copies of their records, they have to be given to those patients. In an instance where you would not would be those records that are actually subpoenaed from the courts. License, regulation, and accreditation. Anyone that wants to operate in healthcare services in order to provide services to a patient population has to be licensed. So facilities have to be licensed to operate in a facility. To operate as a healthcare facility. They have to go under regulations because they have to know what the written laws are, and especially those given by the Centers for Medicare and Medicaid Services, or we call them CMS. When we look at accreditation is the process in which healthcare facilities and organizations undergo special procedures that are required by the law in order to meet certain standards. And of course, standards are the measurements in which the healthcare facility has to perform. A lot of facilities have to go through what we call surveys. That may come through the health department, it may come through OSHA, it may come through CLIA, it may come through Joint Commission. But in order to provide healthcare services, you have to be licensed, accredited, and you have to meet the standards. Okay, moving forward. The next slide kind of give you a listing of accrediting organizations, or shall I say accrediting bodies. And I just have them listed here for you. In your book, starting with table 1-12 on page 34, it actually gives you the name of the accrediting body and a description of what that accrediting body is and what their responsibility is as well. Okay, so make sure you look over table 1-12 that talks about all of those different accrediting bodies. The next slide talks about Joint Commission, NCQA, and then you have your NCCHC, and again, all of these are listed in your book for you. And of course, the last slide, one of the things I want to point out is what we call National Patient Safety Goals and Periodic Performance Review. These are very key, very important to facilities. Periodic Performance Review basically reviews the facility over time, lets the facility know how they're doing in their customer service to patients or in their different services to patients. And the National Patient Safety Goal is a very important component of healthcare because every day that you come in contact with a patient, you got to always remember your first goal is patient safety. Okay, so Joint Commission has a listing of patient safety goals, national patient safety goals that must be met by facilities, and they design those goals based on if you're in hospital or if you're a doctor's office. Okay, so always remember your first goal is patient safety first. Your patients come first. Okay, Now, this concludes the audio lecture for Chapter 1. The audio lecture will be uploaded in the student portal. You'll be able to go under week 1, day 1, or day 2, and you should be able to see the audio lecture for Chapter 1. And so on a different day, you will be able to listen to the audio lectures for Chapters 2 and 3. Thank you.